attention. This upcoming session is on job search strategies. We kind of did this last year in the afternoon session. It was very popular. I mean, the room was packed. It's definitely a topic that you know, many people are interested in. I mean, at one point in our careers, usually multiple times, we're all interested in this topic. So anyway, we have a really great panel put together, and I'd like to thank everybody who has come today and that you're still here, and that I believe that you're going to get some really good insights on how to effectively improve your career direction with some of these good tips. So without further ado, I'd like to introduce the moderator of the session, Richard Katz, who's the CEO of HRMS. Richard?
Good afternoon. It's 2:10. We're going to be done by 3. And we'll try to stimulate you guys enough to keep you awake and to learn something. So we have a panel here, great panel. This panel was selected in order to give you a perspective from 4 potential different hiring sites, or 4 different categories. And they're going to talk a little bit basically about where the jobs are, why the jobs are with their particular type of organization, and what you have to do to potentially be a candidate. Just for a show of hands to see if everybody's listening, how many of you are currently employed? Okay, currently employed. Okay. So that kind of tells us a little bit about the audience. Those that are currently employed, if you can raise your hands one more time and just keep them there for just a second. This is just a quick little survey. How many of you are currently in electronic health record implementation? Almost nobody. Okay, so there's a few of you. Okay, so for those 2 that are currently employed and currently in electronic health records, why are you here? No, okay. Because you want to get ahead, right. So you've got unemployed and you've got people in other functions, which I assume are going to be IT oriented possibly. And we're here to help you all. I'm going to, because of time, I'm going to go through and probably skip some of these slides as soon as I figure out how to make the change. Okay, there we go. All right, here we go. So I'm just going to quickly go through and say that you're in the right place. I don't think I have to tell you that health care is alive and well. There's all kinds of numbers that tell us that if you're going to pick an industry, you know, you pick the right one. It's a huge part of the economy. Even during the slowdown from 2008, when the economy melted down, there was a slight slowdown. There were some layoffs and so on, but it's really, you know, growing and will grow. I'm going to go through. By the way, this question was asked at the very end. It's bipartisan support, according to the people at HHS and Department of Labor. As Janet mentioned, no matter what happens with the Supreme Court, of course, that may have an impact in certain ways, obviously, but in terms of health IT, I have been told by Department of Labor and Health and Human Services and people that have contacts with the powers to be that it does get support from both sides. Good to know. So what I think Janet was saying was that there was the High-Tech Act back in 2008, 2008 and 9 that basically funded high-tech electronic health records. 20 billion, these numbers vary. I think today I heard 40 billion, Janet said 35 billion. I'm being conservative at 20 because that's what I counted up. But regardless, a half a billion, that's not million, but 500 plus million has been devoted to workforce development. That's the umbrella name for anything to do with training people, helping them find jobs. So the money's been filtered out throughout the country. And then you've got Affordable Care Act, which of course is what's on the table now. And obviously, if you follow any news, you know that certain sides of the government want to abolish it. They are spending money out of the Affordable Care Act in workforce development. HHS under the CMS, the Center for Medicare Services, just released and closed a $1 billion innovation challenge, which was a grant solicitation, and there was a workforce development component, a required workforce development component. The whole point of this is that government funding is alive and well when it comes to health IT under both acts, and workforce development's a major part of it. And for sake of time, I'm going to go through these a little bit. So really, anytime change occurs, you've got opportunities, and these are the various types of issues that are related. The point of this is that keep your perspective of health IT in a broad way. In other words, it isn't just electronic health record adoption. It's not just implementing. It's not just workflow. It's not just networking. This industry is quite broad. At the HIMSS national chapter, national annual conference, there was 2,000-3,000 vendors at that conference selling products and services. So these are some of the hot buttons that are associated with electronic health record and health IT, and you want to keep current on these subjects in order to uncover job opportunities. I only put this up here to just tell you that interoperability, that's the term when, as you know, where one healthcare organization talks to the other or exchanges information. It's obviously a very complicated data exchange, and as Janet put it, I think we're a little behind in the ability to make that happen. So it's a very pervasive and complicated issue that's going to be around for a long time. If you're going to stay in the health IT area, and if you're going to be involved in electronic health record, you want to become a disciple. I hope you're a disciple as you sit here. If you're not sure that you're a disciple, just consider your own experiences in terms of electronic health records. These are some of the main benefits that people talk about, and I don't think it takes too much reading or analytical skills to realize that it's ridiculous to keep filling out a one-sheet piece of paper for every time you go to a different physician. I mean, I get like, I'm not going to do that again. Go back to my primary care physician, you find out the information. I don't think it's our responsibility. I think that as health IT experts, as leaders in electronic health records, I just personally take a personal view that if my specialists that I get referred to are not with it, I tell them. I tell their receptionists, I tell their staff, I said, why are you asking me this question? I don't remember what tests I had last year, and that's not my job. I don't want to be responsible. So in your own little way, you can go into the community, and if nothing else, the doctor might prick you harder or something, you know. So that's something that I think that you really want to study. Okay, so for sake of time, I would like to start with introducing Leslie Bruce, who has now been speaking at the conferences for a couple of years. She and I met a couple of years ago in the San Diego area in 2010. Leslie's organization, UC San Diego Extension, has been a leader in providing health IT education, and actually was one of the first recipients of the stimulus funding to train health IT people. So Leslie, why don't you go ahead and...
Thank you. And then you'll just change the slide.
Yeah.
Great.
Sure.
Can you guys hear me all right? Okay, great. Thank you. I'm Leslie Roos at UC San Diego Extension. We applied through our local Workforce Investment Board in 2009 for job training funds. This was not ONC-related money at all. It was strictly job training funds, and we had seen reports coming from the federal government that HIT workers were going to be in great demand. And so we submitted a proposal in the May of 2009 to train unemployed and underemployed people in the San Diego County region in HIT.
Leslie, excuse me, these slides I'm not...
Yeah, just go back one.
All right. Okay, all right. I'm going to let you come up here, I think.
Okay, that sounds fine. So within months, by September, we had a program, an HIT program up and running. Remember, the grant went in May, we were funded in July, we had a program up in September. And that was largely, and if not entirely, due to the generosity of the region's HIT employers. We gathered our HIT employers, they came together, we put a sort of a straw man curriculum together for them to look at, say, are we on the right track here? And they said, well, where's change management? Where's presentation skills? Where's teamwork? Where's conflict resolution? Which was really interesting to me when I thought it was all going to be a very technically based program. But it isn't. Their technical is there, but they were really clear that the people they wanted to hire had to have these people skills also. So we did get a grant to fund 4 cohorts, 100 people, who worked full-time for 3 months each cohort. And so that is the basis from which I am speaking to you today, the program. We put it online after the grant was up, and now anyone from all over the world can take the HIT certificate program. And I'm really delighted to see some of our students here in the audience. Rah, rah for you. They're a wonderful, wonderful group of people, and we had strongly encouraged the students to have experience in IT, clinical experience, and or project management to be able to succeed in this rigorous environment. So one of the things that we always say, and lately anyway, at UC San Diego Extension is that lifelong learning is essential. And in no arena is that more true than HIT. You can't just learn one thing and go, okay, I'm done and I'm going to work for 35 years and then I'm going to get a gold watch. You have to keep learning, you have to keep up, and I'm sure that's why you're all here, because you get that. And I think we tried to instill that in our students also. This is just, the latest step in your education. It won't be the last. So, and we've also found, especially through this experience, that employers, the technology creators, the innovators, the vendors, and education have to do a far different job than we've been doing about collaborating around education. And I think you'll see that as we go forward. So make a commitment to lifelong learning. That's my 2 cents. The needs of the job force in each region vary. In Southern California, without HIT experience, it's almost impossible to get a job in HIT. I'm sure many of you have experienced that. Even with IT background, with all these things, there's just this great barrier. And it's a lot easier because we have so much competition for every job for people with experience to get those jobs versus those who don't have it. And this, as you all know, is the deployment of information technology, and I just wanted to use this to illustrate just a couple of things going forward. We have been at the gathering stage, the digitization of the records. This is where everybody's trying to get up to speed. But when we get there, and some of us are there and beyond, you know, Kaiser Permanente, UCSD, a number of other systems, Intermountain Health, are at this point where they're summarizing and beginning to interpret. They're turning that data into knowledge, and that's where we all want to go. And so I'm looking at those kinds of things as where the education opportunities, where is continuing education going to be needed for the HIT worker. And I'm always interested to hear what people think about where we should be offering continuing education. So if you have suggestions, please let me know. We did a study, the San Diego Workforce Investment Board commissioned UC San Diego Extension to do an environmental scan in San Diego of the HIT space. And they asked us, you know, how do we accelerate our development as an HIT hub in San Diego? We have some natural gifts in that area, and how do we build upon those, remove barriers, accelerate growth? I thought this was an interesting graph from that report. And as you can see, technical competence in IT specific to the job, is what that says, is the highest, but it's not by far the highest. You look at the knowledge of the healthcare environment, that's really strong. And we've heard that over and over from employers. Where's your healthcare experience? Now, our program is front-loaded with healthcare terminology, introduction to U.S. healthcare, how does the industry work, overview of medical practice, so that when a patient walks in the door, then what happens? So we give you a lot of that kind of education, but there is no substitute for experience in an employer's eyes. So they really look for that. You can see all the other kinds of things which I thought were interesting also. Ability to work with different groups. I mean, I have one advisory board member who said that he has one guy chained to the basement because he's not a people person. And he says, but the days of that kind of employee in IT or HIT particularly are over. There will be none of that. They have to be able to work in teams. Creative problem solving, again, you see all this, that how it's not all about the technical. And this was done as a survey of a major HIT employers throughout the region. So I thought you might find that useful. Again, you've heard it, job seekers need experience. Employers are telling us they need experience in electronic medical records. They need experience in implementation and maintenance and in specific software suites they're looking for. If you're Epic certified, you will never go hungry, ever. And so these are the kinds of things employers, at least in San Diego, are looking for. Now, we have seen that in the Deep South, for instance, there are lots of openings and you don't have to have experience. So I've told my poor students, you got to move. You know, just in the short term, you come back when you have experience, but that's one of those barriers. How do you overcome that? So specific software suites, very important. Experience in clinical settings. That's the other thing we hear from employers. We want people to have experience working in healthcare. And even though you're an IT person, you know, who comes along and says, well, you know, my skills are transferable. It's just, you know, one industry versus another. Not to healthcare people. Healthcare, you know, people think healthcare is unique, and you know, in many ways it's true. Lives are on the line. So they are, again, also looking for experience in any kind of healthcare setting. It doesn't have to be the one in which you're applying for a job, but they just want to see that you've been in a healthcare delivery system. So again, we need to forge new collaborations with the vendors to be able to get that training for our students. And not just my students, all students of these HIT programs that even the ONC came out with later. It's vital that we provide those opportunities, and the vendors have been reticent to do that, as you can appreciate with this proprietary technology. But for us to provide the kinds of things, the kind of workforce that the employers are looking for, we need to do that. So the current needs, people are still in that digitization stage. What's coming? Just real quickly, because I know Richard did some of this. Data analytics is the big thing, big thing. And it's a matter of how can we teach it? How can we best teach people data analytics? Does it have to be a degree program? What kinds of things are we looking for? What kind of information, the learning objectives. When a student walks out of that program, they have to be able to do X, 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 and S. And those are the kinds of things we're trying to figure out now. So data analytics is the first, and that includes clinical decision support, meaningful use, ACO readiness, because it's obviously health IT is the linchpin for any kind of quality measurement, and particularly in the ACO environment. The health information exchange. We have a class just starting this summer in HIE. Again, a big thing people need to know that. You heard that from our keynoter. Interoperability and mobile health. This is where San Diego is a real mecca for mobile health. We have Qualcomm, and who is supporting a jillion startups in this area. This is going to be huge. Telemedicine, another very big coming thing that's going to save a lot of money to the system. Of course, cloud computing and privacy and security. Integration, I think that has to do with interoperability. But those are the kinds of things that we're looking at to augment our existing generalist program, because that's what employers are telling us that they need. Happy to answer questions later.
Thank you. Okay, our next, we're going to keep going here because we've got, we have about 35 minutes. So my next panelist is Sunny Saran. Sunny and I met, we're alums from the same school. That always helps to go back to your college. And should I mention the school? I'll just say UCLA, only because Sunny told me to say it, right? Anyway, Sunny, why don't you come on up and we'll talk about health IT.
Thank you, Richard. And I apologize, I have a sore throat, so I can't, my voice is a little bad today. I'll start with, why companies, let me just give you a brief one-liner about what we do as a company. Our company E2O E2O Health provides hosted electronic health records on NextGen product. We are service partners for Calypso and CalOptima Regional Extension Center, where we act as project managers and oversee EHR implementations, help providers choose an EHR, and also assist them with meaningful use. Going back to the question, why companies like us have job openings. As I mentioned before, because of the regional extension centers, I hope all of you know what regional extension centers are, right? Okay. Regional extension centers have certain geographic regions that they need to help the providers in that area to achieve meaningful use. And they use companies like us, service partners like us, to oversee the implementation and make sure the providers are achieving meaningful use. So when we are assigned these practices, obviously we need resources, we need help to make sure that providers are, are taken care of. By the way, while I'm here, I'd like to introduce one of our clients here who represents Calypso, Jim Coburn, who's the director of Gold Coast Local Extension Centers. Maybe if any of you are interested in a job opening, they're hiring relationship managers. Please reach out to Jim. Connect with him. Just get his emails and your resumes. They're actively looking to hire a few relationship managers. So in addition to their hiring needs, I'd also like to share a story why I introduced Jim here. A year ago during this conference, when we were looking for work for a company, Jim, right in this conference, told us, it takes a long time, be patient, we're getting work, and true to his word, 6 months later, he gave us the opportunity to help the providers in his part of the world. So same thing. I know if it's taking long for most of you, just pursue these opportunities, follow up with these people for job openings. I'll go back to what Leslie said. Leslie kind of said experience in health IT is a critical piece, and that is totally true. If you have great IT skills, when you want to get into healthcare, get those internships. People need you to have worked in a clinical setting or experience in a practice. So, and those you get through internships. You can reach out to service partners like us and ask for internships, or even reach out to hospitals. Lots of hospitals are going through EHR implementation. They're in some phase. Some of them have achieved meaningful use, or some of them are in the process, large groups. There are so many organizations which you can reach out to and get those internships. So coming back to my topic, that's, we work with regional extension centers who wants us to help several practices in various areas. And in order to support those providers, we have full-time staff, and we also have interns. We assign most practices with an intern, so interns can learn and also help the practices. Again, the next few lines talk about what we do. For regional extension centers, another point, these regional extension centers are primarily focused for provider groups with less than 10 providers. So you'll get great experience working with small practices when you work with regional extension centers and their service partners. And also, we also, as a company, we also participate in workforce development initiatives. What we do is, most of the regional extension centers requires us to provide sandbox training in various community colleges, and also provide internship opportunities. When we work with CalOptima Regional Extension Center, it's a requirement that they've said that as a service partner, we have to provide 3 or 4 sets of sandbox training in various community colleges, and have to hire a certain number of interns. What this allows us is, as service partners are required to do it as a part of our obligations. So when you find out the service partners in the area, reach out to them, they would love to talk to you. So that's an easy way to get an internship. So we also provide sandbox trainings. What we do is, as I mentioned earlier, we are a next-gen value-added reseller. We provide hosted EHR on next-gen. So we do go to community colleges, and we train. We have these sandbox training sessions on next-gen. So if any of you are enrolled with East LA College or Orange Coast College or Cypress College, you must have seen me. We've done certain sandbox trainings there. Again, I touched upon why regional extension centers have jobs, because they have the funds to support these primary care providers. Please be sure to reach out to Jim. He's the director of a large local extension center which deals with 6 counties. So they have to help these providers to achieve meaningful use. So they have a lot of opportunities. Same thing. I think Richard, you modified some of my slides, I believe. Okay, what are the current recruitment needs that we have? I'll explain our internal recruiting strategy. How do we as a company, and maybe you can relate that to different other companies. The way we would recruit is we offer internship programs. Usually the internship programs that we provide are 6-week, unpaid, and where you get to work at a clinic, at a practice, a small practice, and also you get to attend our Friday training sessions where we train on next-gen. In these 6 weeks, we make sure that you are trained to get a next-gen certified professional certificate. So that's the 6-week program. That's how we do our initial set of internships. And then, based upon the performance of the interns, we recruit those interns for a fellow. This is a paid internship for 3 months, where you get more learning. Again, it relates back to Leslie. That for someone coming out of IT or somebody who has never had a healthcare background, our internship and a fellowship program, we make sure in the initial 3 months, we make sure we give that experience. It's definitely a lifelong thing. 3 months can teach you a whole lot, But what we do as an organization is we want to make sure our people who are representing E2O are well trained. That's what we do as an organization to train the interns, make sure that they're certified, they have these opportunities. And once that's done, then we, depending on our needs and depending on various opportunities, we hire those interns. That's how, as a company, we recruit. That's our recruiting, policy. Again, every service partner has their own thing, but internships definitely. Every service partner or healthcare IT firm in the area, they have their own recruiting standards. Please reach them, and that's a good way to reach out for internships. Finally, the current internship openings at E2O, we're looking for IT help desk specialists, trainers, experienced software, hardware salespeople. I mean, that's what we're looking for. So if you have any of those skills, if you're coming from another industry, please reach out to us. You can go to our website, e2o.com, or reach out to me at support@e2ohealth.com. Thank you.
Thanks, Sunny. Okay, Barbara. Barbara's nice enough to come out from Orange County, who is working with a large healthcare system. And for those of you that are in Orange County, you certainly know what Hoag is, and she's going to share with you recruiting and employment within a healthcare provider. Barbara?
Thank you. Well, Leslie did such a great job. She actually stole a lot of the points I was going to make, so I'm going to try to shift gears a little bit, but I'll at least talk about what we have going on at Hoag. And pretty much everything that you learned about today is happening there. We're currently rolling out an electronic, the EHR. It's actually been rolled out, but this summer we're going live with our physician order entry and the electronic med administration record. We're going live with our focus on that initiative is to reduce medication errors. And by September, we hope to be live with a closed loop med administration process. We're also getting ready to focus on meaningful use, and we'll be doing a lot of work with clinical documentation. We're, in addition to that, the programs that aren't under my scope, include working with, we're doing the ICD-10. We've actually done a fairly good job already of rolling out the HIE. So we have many physician office practices that are sending data to the HIE. We're sending data from our clinical record there. And we just recently started being able to actually use the information in the emergency department when patients come in. We have nurses who are going out to the HIE and trying to get the community medicine medications that they're taking by tapping into drug databases. So if people have had their prescriptions filled, I'll slow down, by a participating pharmacy, then we are able to know what medications they are on, because one of the hardest things when a patient presents to the organization is to really get an accurate picture of their healthcare background. So having access to that information is really helpful, particularly in the organization. So another part of our focus then is we need a lot of different resources that Leslie talked about. So we need people who are able to do the clinical analytics that she talked about. We doubled the size of our staff in the past year in terms of resources that come from a clinical background that can serve as informaticists, and they're helping with a lot of our workflow redesign as we look at the change that we're putting on the organization to go from, in some cases, physicians still documenting in paper to now doing physician order entry and soon doing clinical documentation. We have resources that are involved in building the system. Some of them have nursing or pharmacy background, but now they're working in actually doing configuration practices. We have resources who are also focusing on project management. So we're always looking for project managers to come in. We prefer people with clinical experience, but that's not always a requirement. We need people to help with testing, and this can be a way sometimes if you haven't done a lot of work in healthcare, but you are able to participate in doing testing, that can be an inroad in for you. And we also need people who do training. So if you have an education background and you can learn how to put training modules together and so on, then that's another way for you to find work in healthcare. So in terms of again, our focus is just like Leslie and others have said, we prefer people with experience, but right now the healthcare market is so tight in terms of many organizations attempting to do the same things at the same time that it's very competitive out there. And sometimes we're having a hard time finding the people with the knowledge and background that we actually want. If you've worked for one vendor, usually you can get experience. Usually you're more eligible, even if it's not specific. So we're not an Epic site at Hoag, so we like, it's not that I wouldn't take somebody with Epic if they've helped with the projects themselves. In terms of, I'm just going to throw a lot of these up here right now just so I don't have to keep pushing the button, but what I personally look for is someone who kind of has a can-do attitude. And it's really helpful if you do a little homework on the organization that you're applying for. What's their reputation? What are they known for? And how can you be a good fit with that organization? Remember when you're interviewing that we're interviewing you as well as you're interviewing us. But I've had it sometimes when I'm talking to a consultant, they're so busy trying to interview me to know if our site is a good fit for them. They don't give me a chance to ask questions about them and their experience, and they kind of rule themselves out by doing all the talking and not much listening. So it's really important when you're putting an interview together and so on that you really listen for what it is that that organization is looking for, and then you answer the questions based on your skills and background or what training you've received that will help them see that you would be a good fit for that organization. Another thing that I think is really helpful is similar to what Leslie talked about in terms of really being a team player. So a lot of times now people are working in teams. We have a lot of things going on. You have to be able to play well with others. And if you can demonstrate that based on other activities that you've been involved in as you're going to school or as you're in other career opportunities, to be able to demonstrate that you're able to be collaborative, as well as being able to work across an organization. So even if you haven't always worked in healthcare, but you can show that you deal well with more like service employees as well as executives, that really can help you be the person who gets the job versus someone who isn't able to articulate that or demonstrate that. We brought in about 10 nurses from the hospital that had not worked in IT before. They demonstrated some willingness to do that. We trained them, but they really were able to say, I care about patient care, I care about information, I care about making a difference, and so they showed initiative to us, and so we were willing to put them through an extensive training program, and all of them now are very proficient in helping look at workflow, being able to help work with physicians, respiratory therapists, people in lab and across the organization, even if they hadn't really done a lot of that before. So if you have a clinical background and are looking to get into IT, if you're able to talk about why you want to make the change. For me personally, it was about, I knew as a nurse that I was good at patient care and I was impacting healthcare a patient at a time, but with getting into information technology, then I was able to help address the system of healthcare and be able to make a difference overall from a quality perspective. So if you're able to kind of have a story that you're able to sell yourself a little bit and make yourself more appealing to the people that you're interviewing with, be professional, be respectful, all of those normal things, but I think it would help you be successful in being that candidate who actually gets the job. So thank you.
So I think you heard a couple of basic concepts. At 3 o'clock, we're going to have a second session here, and we're going to get into some detail about some of the concepts that have been described here. I think you heard the term transferable skill. I've been a trainer installing ADP, payroll services for big corporate Fortune 1000 companies. That's a transferable skill into the training environment. We're going to talk about soft skills because in many cases you can overcome a lack of experience by having a soft skill. Soft skill is, does this person look like someone that I want to work with? I mean, I think that's the bottom line. We're going to talk about selling. Why are we going to talk about selling? Because in the process of any kind of a job change or job search. You're the product, you're selling the product to the buyer. And really, when it's all said and done, you need to think about improving your selling skills. Moving forward here, so we'll leave some time to do a Q&A. Mark and I met not too long ago. Mark's company, Atrilogy, is involved in the staffing business, so that's a third party that helps employers and job seekers find each other, and in some cases they recruit away people. But the point is that, you know, Mark's point of view will certainly help you understand how to approach a staffing organization, of which there are many recruiters here at this event, actually, many more than there were last year. I think that's a good sign. So, Mark?
Thank you, Richard. As Richard mentioned, I work for Atrilogy Solutions Group. We're based out of Irvine, and we are a healthcare IT consulting firm. In the EHR area, we provide mostly staff augmentation to our clients that are looking for high-quality resources for their EHR implementation projects. I created this slide here to represent what really our clients are looking for, and really I think our clients have high expectations for what they're looking for. So if you look at this chart, at the top is really the spectrum of things that they're looking for. They're looking for solid experience, first of all, and you know, that's difficult for the folks in the room today that are looking for a new position in HIT or EHR implementations, because it's difficult to get that experience, right? So they're looking for strong healthcare experience, strong clinical experience, and preferably somewhere in the range of 3 to 5 years worth of vendor product experience and specific experience in the module that they're hiring for. So if it's a billing module or a pharmacy module or whatever particular module, they're looking for that specific experience. And that's always difficult to find, and we're finding our clients are very challenged with finding the right level of experience for individuals that they want to bring onto their team. In the skills area, they're looking for people with exceptional communication skills, because that's critical when you work on these various teams that my other panelist mentioned here this afternoon. They're looking for individuals that have either vendor certifications, if those exist, or at least have gone through and completed the training associated with the vendor products that they're implementing. The ability to wear multiple hats is absolutely critical. No longer are we in the situation where one person can just do one thing and play one role on one project. Our clients need people that can do configuration work, do testing, write documentation, do training in some cases. They need to be able to do multiple things. And so they're looking for people that can wear multiple hats on their projects. And then the personal characteristics area. This is very, very important. What we hear from clients all the time, I think some of my colleagues have mentioned this today, is that being team-oriented is absolutely critical. We can't have any cowboys on the projects at our clients. Cultural fit is important. This is something that's very difficult, I think, for people that are coming outside of healthcare. Healthcare has, I think, a unique culture. Would you agree to that? And so I think and each organization has a little bit different slant on that cultural fit, but it's important that people that are going to be part of these EHR implementation teams fit within the culture of the organization they're going to be working for. Obviously, strong personal and interpersonal skills, we mentioned that before. That's absolutely critical. This is a very team-oriented environment, these EHR implementation efforts. And then lastly, this is kind of an interesting one, known steamroller types. You know, there's people that get very excited about their new position and come in, they want to take over the world, And, you know, that doesn't really work. So I think it's people that are going to work within the confines or the structure or the style of the organization. I think that's very important. That what we hear from clients from time to time is that we want people that are going to fit within the project teams. So that just gives you a summary of what we're hearing from our clients in terms of what they're looking for. So I think the bar is pretty high, and our clients have high expectations. A couple other things I just want to share with you that I feel are very important. We all need to be doing this. You know, some of us do this as part of our job or part of our annual evaluation, but we need to have our own personal scorecard and development plan. So we need to be listing out those things that either our existing employer or our future employer or the market is looking for in terms of experience, skills, or personal characteristics. And we need to inventory those and really be honest and truthful of ourselves of where we are, where we stand in terms of the requirements for each of those experience, skills, or characteristics. And then put together a development plan so that we're improving in each of those areas where we need to improve on, so that we can get that next position, we can move on in our career and take more responsibility and move forward in our development and career. So I think this is a very important thing that people miss out on, is making sure that we have a development plan for moving forward. Just want to share a few development ideas. I think Leslie mentioned before, you really need to be a lifelong learner, and that means involvement in HIMSS and any other professional organizations that are appropriate. PMI is a good one for project managers. Reading industry journals, websites, being part of LinkedIn groups, free webinars. There's a bunch of free webinars that we all get emails about all the time, and some of those are absolutely fantastic. So you really need to be a sponge for knowledge and continuing to grow and be a learner throughout your career. It's not just a one-time thing. Secondly, you need to be able to leverage your volunteer opportunities that are out there. And I think Leslie mentioned that for folks that don't have the experience, and which is probably the biggest barrier or hurdle for getting a job in health IT or EHR implementations, you can take advantage of a lot of volunteer opportunities to really gain and build on that relationship, or build on that experience that you really need to have. And employers really love this, right? They really like to see that you're out there and you're working hard, you're being creative in terms of developing yourself and gaining that expertise and experience that you're lacking. And I firmly believe this is a critical thing for you to do, especially if you don't have the experience. Education and training, continuing to reach out for proven education and training. And here, if you're coming from the clinical side and you don't have that IT background, you need to really brush up and really gain those IT skills. So skills around issue management, risk management, change control, those key IT processes. You really need to develop in learning and expertise around those areas. And then for IT professionals, again, it's that healthcare knowledge that you need to be gaining knowledge around. Read Modern Healthcare every week. I think that's a great thing or every month that people kind of miss out on. Is there's great healthcare journals that aren't IT related. You should use them. And then continue to round out your skills. If you've been a configurator or a tester, work on or ask for new roles on your next project. Maybe it's workflow analysis or project manager or HIPAA related. Continue to build out your skills. And then lastly, I think this is very important, is ask for feedback. I think people miss out on this all the time, is asking, not only from your manager or your people who work for you, but your peers as well. Kind of that 360-degree feedback. I think that's absolutely critical. Thank you for your time.
So let's give them all a hand, okay? Okay, we've got a couple of minutes, so Ask the hard questions. 'Cause- over there, please.
I would like you to use the microphone. Stand by.
Good afternoon. My name is Abe Ali. I just throw this question to the panel. Do you have any comments for management experience, IT management experience? What is the need there in healthcare organizations, directorship level, management level, in contrast to the technicians, workflow specialists, so forth?
Abe, if I can just ask a question back real quickly. Are you currently in the health IT area and you want to move into management, or you're currently a manager?
I have recently left, after 9 years, at the directorship level, a healthcare IT services and solutions provider.
Okay.
So I was managing a solutions and services practice at an IT company.
All right. Anybody on the panel would like to take a stab at that?
So I'm willing to take that one because I did a similar thing. I was a director of IT in my past. I went and worked for a software company for a while and now back in healthcare. So yes, there still is needs out there for qualified managers, people who are able to work well with, motivate people, get them to work effectively, efficiently. If you can demonstrate your skills in leadership and management, I think there's definitely work out there.
Great. Thank you. How about another question here? In your particular circumstance, you're here, you want to move someplace else? Yes. Go ahead and I'll repeat the question if. Oh, okay, here comes the mic. See, hold on one second. Thank you.
Oh, thank you. You mentioned for people with IT backgrounds that to get experience to work, to volunteer. Other than a hospital setting, can you make some suggestions as to where to volunteer?
Yes, in fact, I'm a huge believer in community clinics. And they are going to be, first of all, they are a backbone that people don't even know about, community clinics in this country. And their role will only grow as a magnet for primary care for the expanding Medicaid populations. So I have encouraged our students to look at that as well as hospitals, because I think, frankly, hospitals are getting harder to volunteer with. I mean, who would have thunk, right? But they put people through incredible, rigorous screening and all of that, which is fine, but it's not as easy as it used to be to volunteer at a hospital. And the other thing is that they're a lot farther in the EMR adoption, so primary care is really, a better place to be. So community clinic. The other thing that I had a very enterprising student who went to the VA. You can volunteer at the VA and talk about electronic medical records. I mean, you can really learn a lot there. So don't forget the opportunities at both the DoD facilities and VA. But I mean, I can't say enough about community clinics.
Leslie, as a follow-up point, would you know what type of occupation someone like this woman could volunteer for, assuming that you have healthcare background?
No,
That's why she needs to volunteer.
Okay, right. So with her IT background, where do you think she would most likely fit into a community clinic? I know that's.
Yeah, normally when you volunteer in healthcare, you volunteer in some kind of healthcare delivery capacity. Oh, you're taking the patient from here to there or whatever. So that's really good because then you learn workflow. If you have the opportunity, sometimes you can actually volunteer in the IT department. That's not as easy to get. They're not used to volunteers in the IT department. And I think part of what we're asking providers to overcome is, the fact that their IT departments have never had interns before either. And they need to get over that and make that regular part of their culture. But so you might be able to volunteer in the IT department, but I hate to see you overlook the opportunity to learn workflow, patient care, because that's what's going to make you valuable.
Also, I believe Sunny's organizations would be an example where a person with IT background but without the clinical background might have an opportunity to work as an intern. Sonny, do you want to comment on that?
IT is kind of broad. IT is kind of broad. So you have
One
the
thing
IT.
that I've heard a lot of, or not a lot, but several physicians mention that they're finding value in is they're able to identify med-seeking behavior and abuse
Where is
of
that
pain
person?
medicine. So
Where-
all of a
Where-
sudden, patients are going around town seeing multiple doctors, complaining about the same thing, wanting pain medications. They're finding out they're getting prescriptions.
That's pretty scary, huh?
They're also starting to find as that exchange branches out, that they're also going to outside.
We'll assume that that's a supernatural kind of thing.
That's something I think.
And health IT is a great field. There's a lot of things going on. Sonny, do you want to try again?
Yeah, IT is kind of broad. So you have the whole networking and privacy and security side of things, the help desk side of things, and programming and database side of skills. So, as Leslie said, focus. I mean, when you want to get a internship, get the clinical experience, the patient delivery. How does a doctor see a patient? What's the check-in process? What's the checkout process? Understanding that is critical. Then the next step is then how do you transfer the transferable skills, the skills that you already have, into the health IT positions. But getting that, as Leslie said, that's the key thing. Other organizations, there are large provider groups, community health clinics. I've seen, actually, there are some good examples I've met today who've done some internships 6-7 months ago and who are actually working full-time now. Because they're the ones who would probably give you an internship easily. So I would really second that.
I think it's safe to say that a community organization, a community clinic, has less money, less resources, and more apt, and they're more social service oriented. Not that the rest of us aren't, but they're more likely to say, "Sure, come on in. We'll figure out a way to use you."
And to add to
Be a
that,
gift to each other. Yeah.
and add to that, most of the times the community health clinics run an expensive EHR application as well. So you learn good EHR application when you do a volunteer internship.
So as a final note, I put the emails of us up on the screen here. Feel free to shoot us an email. And it's 3 o'clock, so we're going to move into the next session. And thank you all for your attendance.